blood clots and the cannabinoids. Excellent timing on this question because the broker just asked it to me, so I finished a deep dive on the subject, and the answer is yes and no. I'm Lex Pelger. I do Canna education for CV Sciences, the makers of Plus CBD. CBD and THC products for shipping to you anywhere in the US. On the cannabinoids, ask me anything. For starters, you just gotta love it when you have clinical data like this. First, you have this study in trauma patients that found those using cannabis tended to have less blood clots. And then you have this study in trauma patients that showed people use cannabis tended to have more blood clots. To make sense of what's going on, this is a great review paper that's free online, and it shows that some of the cannabinoids are anticoagulatory and some of them are procoagulatory. Basically, you have two systems which are trying to balance each other out. Your coagulation system wants you to stop bleeding, like someone with hemophilia would, where they might bleed out all the way, versus your fibrinolytic system, which is in charge of clearing out any blockages that might be happening in your blood vessels, which can also lead to problems. There is increasing evidence that the endocannabinoid system is involved in these diseases of coagulation, but exactly how it's regulating it isn't exactly clear yet. Luckily, that paper contained a great table looking at when the cannabinoids are anticoagulatory and procoagulatory and the mechanisms that might be happening to cause that. The most important one to know is here, THC, CBD, and cannabis. And it's because of how they interact with warfarin, which is one of the main anticoagulant drugs being given out there. And I know my last boss, Dr. Duffy, said everything screws with warfarin. It is such a touchy drug. And it is probably the most known of the drug-drug interactions that occur with CBD. There's a number of case reports of basically people taking warfarin and CBD, and it might have increased their warfarin levels in their blood by 30% or something. So they had to dial down their warfarin dosage by 30% if they wanted to keep taking the CBD. What's happening there is that these cannabinoids are interfering with some of the liver enzymes that remove warfarin from the system. And those enzymes don't work as well, so warfarin doesn't clear at its normal rate, and then your dosage is high. But that should be something you can work with your healthcare practitioner to dial in that level and make sure the warfarin levels in your blood are in the range that you're looking for. But definitely something to watch out for. But then in rats, you have cannabis extract prolonging the time it takes for clots to form. But then the next study is cannabis extract causing rats to have decreased clot formation. Then in human and rabbit platelet studies, CBG, CBN, CBD, and THC all inhibited the aggregation of those platelets, which are the things that form clots. You also have the endocannabinoid anandamide inhibiting platelet aggregation as well. Lastly, a warning for anyone using any synthetic cannabinoids on the streets. Sometimes they are cut with things like vitamin K antagonists or other drugs that are anticoagulants. So you have stories of people using a whole bunch of synthetic cannabinoids and then their blood doesn't clot because they didn't realize that they're taking a whole bunch of anticoagulants that are being cut into their synthetic cannabinoids. It's weird, but it's one more reason to test anything you take. Now moving on to the procoagulatory effects, and the first reports are from synthetic cannabinoids because these can cause strokes in people, and strokes are blood clots in your brain. So it's one more reason to be careful with synthetic cannabinoids because they could increase blood clot formation and lead to strokes in people with no prior risk factors. Then for chronic THC exposure, they link to two studies where they look at trauma patients, both adult and geriatric, and them having an increased risk for blood clotting after their surgeries. Also, the link between acute cannabis smoking and heart attacks might be because of the coagulation properties of cannabis smoke. It does seem like THC is using either the CB1 receptor or the CB2 receptor to increase platelet activation. Finally, on 3 of the endocannabinoids, there are 3 preclinical studies linking 2-AG anandamide and its endocannabinoid cousin virhatamide to platelet activation and aggregation. So while all of this might sound a little scary, I think the thing to keep in mind is it doesn't seem like these are giant effects. There's not huge links between cannabis use and strokes and heart attacks. There isn't a lot of problems that you hear about in people with coagulation and their cannabis use affecting that. The main thing to watch seems to be interactions with the drug warfarin. But I haven't seen any case studies of people with coagulation difficulties being particularly altered by their use of the cannabinoids. If you are someone like that, or if you've heard stories like that, I would love to hear, but I haven't seen the research so far.